What we're going to do right now is we're going to make a lingual line angle to lingual line angle incision more towards the palate. And we're going to then go ahead and reflect this soft tissue. There is not a ton of bone buccal lingually, curved. And so we're more than likely going to have to graft on the facial. We're going to try to do some bone expansion here. Don't know whether that's going to end up being with the osteotomes or whether or not that's going to end up being with our densibur. But we'll figure that out once we get in there. So the thing that we have to do is we have to make sure we're creating enough space here on the facial if we end up having to do a graft. And we're just kind of trying to gauge, if you will, the fact that we're going to lose. Yeah. So, all right, let me have a straight blade, please. Try to just make an incision on this distal here and see whether or not that doesn't help us out. It may. Curved. Always go ahead and 14 again, please. Let's do 1 and 1, please. So now we can visualize what we need to see here. So one of the things, as you can see here, that we've got our bone is actually above the CEJs. And we know that in a healed site that we want to place our implant 2 to 3 millimeters below the CEJ. So what we need to do is actually recontour this crustal bone here and leave the interproximal height so that we can maintain the possibility of our papilla. So that will work out very nicely for us. And again, you know, we'll see whether or not I may actually end up making. We're going to leave the interproximal bone intact. Problem is, I can't really. I'm going to go ahead and recontour this bone all the way through the palate now. We can really figure out where this bone needs to stay. We definitely want to make sure we keep that interproximal bone because we want this to be there for the support of our papillas. Hold that lingual tissue back, please. Awesome. Okay. So now let's take, so this is where we're going to now make sure, because this tooth is like this and this tooth is like this, so we got to really be pretty dang accurate here. So this has to start here. Yep. Okay. Suction. Suction. It's crazy just how, I am literally just pushing that in, right? All right, and then go ahead and just tap for me there. It's a little bit. Stop. All right, cool. Beautiful. Okay. Add one more versed. All look pretty good up there? Yep. Great. Yep. Suction. That just looks fabulous. Thank you. So there's our implant. See how crazy that is? I mean, I know I'm strong, but okay. Use your right hand there.
This is on 30 on in.
Thanks. All right, now, question I have is, do we have that healing abutment that we can put on there that's parallel? That's 3 millimeters. And this is a 3?
It's a 3 millimeter height. It's a 4 millimeter diameter.
Okay. Let's take that and put that through a plug, please. And then we're going to put a little graft out on the buckle.
You want the graft first or the plug first?
The plug first, please. I'm going to need a Woodson one, please. Okay, great. Take that. Thank you. Do you have a little bit more?
Mm-hmm.
Okay. Fantastic. Now you're going to have to take the that other membrane. You're probably going to have to cut it in half.
Can I come out?
Yep.
Do you want the side with the red blood cells, or do you want just this side?
Yeah.
Okay.
Please.
Her BP went up.
Add one more, please. Okay. Curved acid and a straight blade, please. Nope. That's not good, Danny. Be a 14. Wasn't expecting that. But good news. We do have our membrane there. Alright. So, I'll start pulling on that until I release it back here.
Okay.
Don't go in the loop. Don't go in the loop. Is that a good bite or not?
Yeah, good. Much good.
See how you're coming at this straight on here like this?
Yeah.
Okay? So that's why you're struggling. Sometimes you actually have to take your hand and you got to come over like this
Okay.
because of the angle.
Okay. So flip your wrist and grab the tail. And then turn yours back, and then it points it that way for him. Okay.
Hold on a second.
When you have the tail, just kind of keep your hand in one place. Don't bring it to him. Okay. He'll come and get it from you.
A 90 grain will come and straight it like this.
Okay.
So the only way you're going to be able to get that like that is to come from here, because you can't get it because of this tooth.
Okay.
So take that just like that, and then you got to rotate, and then rotate right back. There you go.
Just always watch out for her lip too. Okay. As you come up, so you don't go pierce it.
Now, is that a good bite in there?
Yeah.
You rotate it back. There you go. When you rotate it back, it gets the needle away from her lip.
Got it. Grab the tail. Yeah. There you go. Good. And you'll know when he's done tightening.
So I'm not done tightening, honey.
Okay.
I'm going to bring it to you.
Okay.
So when I'm going like this and you're going after it, you're grabbing it too soon.
Okay.
So as soon as I bring it up like this, now you can go after it. Okay. What's in one? I'm going to take this next one.
Okay.
Other side.
Yeah, that works. If you're able to and it helps you, you can take your pinky and like anchor your hand down, and it kind of helps you gain more control.
Got it. I just need to practice more with my left hand.
Yeah, of course.
Now I'm going to take this one too.
Got it.
Yep, stay right there. Woodson one.
You have that over there?
Let me take this. It's one of those, anytime I think there's a possibility of a tissue tear, I'd rather blame myself than blame you.
Okay.
So that's why I do that. Alright. Let's see here. Mirror. Alright, so let me have a Woodson one, and I want some butyl, please.
What do you guys get that? Mm-hmm.
Jake, is the butyl in the assistant's room?
In the fridge.
Okay.
It's that purple liquid.
That's right.
You get it with the dropper and the definition.
Okay, so
It's either called butyl or pericurl. Either one, you might hear both names.
Okay.
looks pretty dang good, doesn't it?
Yes, it does.
Mm-hmm.
And when you're suctioning, just kind of hover over it.
Okay.
Give it a second, and then water activate it.
Beautiful. Awesome.